The National Institute for Communicable Diseases has reported 7,983 new COVID-19 cases in the country. This brings the total number of laboratory confirmed cases to over 2,613,000. 299 new COVID-19 related deaths have been reported, bringing total fatalities to 77,440. The province with the highest number of new coronavirus cases is the Western Cape with 2,119, followed by KwaZulu-Natal with 1,949. Gauteng now has 694 new cases. The recovery rate remains at 91.2%, with active cases increasing to over 153,000. Right, for the latest developments on COVID-19 and, of course, the vaccination drive, we're now joined via Zoom by the Acting Executive Director at the National Institute for Communicable Diseases, Professor Adrian Puren. It's always a pleasure to see you, Prof. Good afternoon to you.
Good afternoon to you, and thank you very much for the opportunity, and to your viewers. Thank you.
You're most welcome. I just looked at the stats just before going on air with you now. At this time, it says 4.2 million people in South Africa have been fully vaccinated. That's roughly 7.2% of the population. Are we moving at the right pace? I mean, it's easy to say that's a small percentage, but I mean, if we are on track, then it's a different story, isn't it?
Yeah, so actually, when you do look at the graphs, I think the Department of Health has expressed its concerns that, in fact, the peak of vaccinations has been reached. In fact, there are declines in the numbers of people being vaccinated in the different age categories. I know that they're going to move the age categories right up to the age of 18 to be enrolled. But I think there's a critical need to address each particular age category, and especially age categories where we know that there's also the comorbidities such as respiratory diseases, obesity, hypertension, cardiac diseases. These are still categories of people that need to be vaccinated. So I think there needs to be not necessarily a rethink, but really a drive to ensure that we can get those numbers up again to the levels that we were expecting to see.
Yeah, Prof, I mean, I'm hoping you can explain this to me. I mean, with the vaccination program now fully in effect, one would think that we wouldn't still be recording such high numbers of confirmed cases and deaths. I understand that we're very far from reaching herd immunity, and as you rightly say, that the numbers are quite low still. But surely, if effective, the vaccines are effective, then there should be some difference at some point that we are seeing. I mean, some people should be at this time sort of immune, so to speak. So one wonders why these numbers are still where we're used to them being.
Yeah, so you're quite right. I think it's a mixture, really. It's really to try and disentangle that is really going to be really critical. But I think we've seen the first results of that, to answer your point. Yeah. The idea behind the vaccines is really to prevent serious disease, hospitalizations, in other words, and death. So even though people are vaccinated, we will see what are called breakthrough infections. However, the effect is that we will still have milder infections in those particular individuals that have been vaccinated. Yeah. And as we saw from the evidence from the Zonki trial that had expanded to vaccinate the healthcare workers, that in fact the vaccine effectiveness was actually very good. It was excellent, as well as the fact that in terms of the severe disease and hospitalizations, again, it had really high levels of protection. So I think that should, if we continue vaccinating at these high rates, then in fact we will see disease and breakthrough infections, but we will see mild disease, and the effect of the vaccine, if it's effective, is that we will see less hospitalizations and less death. But we really need to get to those points of really high levels of vaccination.
Yeah, you spoke about the risky groups who really should be getting the vaccine at this time, but I want to talk about the age groups really. At this time, what age group is dominating the latest daily cases that are being recorded?
So I think it's still in the 60-year-old age groups. If you think of the vaccine, the absolute numbers are certainly in the old age group. Again, I have not seen the full coverage. I think that's going to be a critical denominator that we need to see. What is the coverage in each particular age group, to know to what extent have we covered those particular age categories. That's really going to be very important.
Yeah, it's been confirmed that South Africa will face another wave around December. Looking at the vaccination rollout program, do you think that we may miss that wave, or maybe manage if we can speed things up to save more lives than we've lost in the other waves? Just if we start to kind of get more people getting vaccinated.
Absolutely, I think it's really going to be critical for us. I think that fourth wave, if it does occur again, I don't think we want to precipitate a fourth wave. So I come back to the point that we still need those non-pharmaceutical interventions. So even though people have been vaccinated, we really need to emphasize that they still maintain the non-pharmaceutical interventions, because they could still be infected, and you really want to prevent severe disease, of course. But I think the vaccine is really a critical way in which we can actually change the characteristics of that particular fourth wave in terms of not necessarily that the numbers may well be there, but in fact not overburdening our hospitals and also preventing mortality. So it should really look different, and provided that we really encourage, especially in the high-risk categories above 50 and so forth, to really get vaccinated.
Prof, what do you know at this point about vaccine hesitancy and how much it's stopping or preventing us from getting to what we'd like to see, which is, of course, the herd immunity? Is there still a major obstacle when it comes to the issue of vaccinations, or is the factors of accessibility maybe an issue? One would think that there's enough places to get vaccinated at this time, and we can see that the messages that come through and tell people where to go and when to go have been in fact quite effective. So I wonder if the issue of hesitancy is still quite a major issue when it comes to this vaccine drive.
I think there may well be a degree of that. I think that there are people who have some really hard-held views about vaccines and their effects. There's obviously a great deal of the so-called info pandemic in the sense of the incorrect information being in circulation, especially through particular applications such as Twitter or Facebook and so forth. So these still play a role and influence people. But I'm hoping to come back, as you correctly point out, I think the initial levels of vaccination may well have been around accessibility, but I think there are new and innovative ways in which this is being approached. So I'm hoping that will certainly overcome that sort of 20% or 10% in terms of getting people vaccinated, because we really do need to reach high levels of vaccination, especially in the context of this, the current circulating Delta variant. I think that will be really critical for us to manage. Of course, that doesn't mean that a new variant won't arise. It will be different. Hopefully not as severe, but you never know. You never can tell. So it's really critical for us to approach the community and saying, where is it that you can get information that you can trust? I think that's really critical.
Yeah. Prof, we always appreciate your input here on SABC News. Much appreciated.
Thank you very much for the opportunity.
Right. That is Prof. Adrian Puren, who's the Acting Executive Director at the National Institute for Communicable Diseases. Well, while vaccinated